Good afternoon, everyone. Let me first of all thank you for being with us. Honored to be joined by our First Lady Marty Kemp today, certainly Dr. Toomey, and Department of Community Health Commissioner Kathleen Toomey is also with us today. Let me just start with a few things here. First of all, I want to continue to encourage unvaccinated Georgians to talk to their medical professionals or those that they trust and consider doing so. This safe, effective vaccine reduces the likelihood you will get infected with COVID-19, but more importantly, it drastically will reduce the chances of you ending up in a hospital bed or losing your life. In fact, during my call with the Metro Atlanta Hospital CEOs last week, they reiterated on the call that well over 90% of all Georgians currently hospitalized with COVID-19 are unvaccinated. That's why I've written again to the FDA to encourage them to grant full approval to the vaccines in order to address hesitancy among many Georgians who haven't gotten their first shot yet. 168 million Americans have already been fully vaccinated, and thankfully our numbers continue to rise here in Georgia. But one of the things that we continue to hear from those who haven't been vaccinated is the EUA status of the vaccines. I'm hoping that the FDA will act soon and we can continue the great efforts that state, local, and nonprofit and private sector leaders have made to get more shots and arms. As I've mentioned last week, I held another routine call with CEOs from the Metro Atlanta area where they provided a status update on their ongoing efforts to fight COVID-19, but also care for other pressing health care needs of the people in their communities. I'll also add that my office has been in contact with many of the rural hospital leadership teams over the weekend and yesterday, or prior to the weekend, into last week, and also today through communities throughout our state. Virtually every hospital's most pressing issue is a lack of qualified staff to treat the patients coming through their doors. Nurses, respiratory therapists, ICU personnel, just to name a few. Through October of this year, the state, coordinated through the Department of Community Health, has already committed $500 million to provide 1,300 staff on an ongoing basis to 68 hospitals across our state. To expand those efforts, I'm announcing today that Commissioner Noggle and her team will increase the total number of state-supported hospital staff from 1,300 to 2,800, more than doubling our staffing assistance to date. This would amount to an additional $125 million of investment in state-supported staffing of hospital systems in both metro and rural areas through the first week of December. Specifically, 170 of these new staff will go directly to rural hospitals. Commissioner Noggle and her team will have also identified 450 beds in 9 regional coordinating hospitals that will soon be available to treat patients statewide thanks to this additional staff. As we move forward, my team and I will continue to monitor the situation in our hospitals to ensure that Georgians who need access to care can receive it. Also, to encourage more state employees to get vaccinated, today I'm also announcing that state offices will be closed Friday, September 3rd, in advance of Labor Day weekend. I'm asking all state employees who have not yet gotten their shot to consider scheduling it on or before Friday, September the 3rd. For those of you that have been vaccinated or got their shot before September 3rd, please take this day off as a thank you for all the work that you have done and for stepping up to help protect yourselves and protect others from you during this pandemic. And enjoy this time with your friends and family. We certainly are appreciative of all that our state employees have done over the last year and a half, going on 2 years now, working through a global pandemic and keeping our state running. Finally, today I want to reiterate that Georgia will remain open for business. We will not shut down. We will not prevent families from earning a paycheck. Georgians know the risk of this virus, and they know we have the tools at our disposal to prevent serious illness, hospitalization, and death. The most important thing for Georgians to do at this point, if you're not vaccinated, is to please talk to your doctor or medical professional or someone that you trust that perhaps has been vaccinated, and make a good health care decision for you and your family. As you all know, our 3 daughters have been vaccinated, and Marty and I have as well as our parents. As I've said for the last year and a half, I'm again asking Georgians to be part of the solution to this virus. Again, thank you all for being here, and I'll turn it over to Dr. Toomey, and then we'll take some of your questions. Thank you. Dr. Toomey.
Thank you very much. I just had a couple of remarks I wanted to make about the current increase in cases, which are about 90% Delta variant. Again, this variant is much more transmissible. It goes very quickly from person to person. It causes you to become infected much more quickly within a matter of days rather than a week or longer. And so, not surprisingly, it's making a beeline for unvaccinated individuals. The good news is that vaccines do work. They are protecting people from consequences of what is a potentially more dangerous virus, and it's really good to see that that is happening. In the hospitals, though, as the governor was saying, we are seeing increases, and significantly, we're seeing increases among younger people than we saw before. And so the highest rates yet that we've ever had among individuals 30, 40 years old, higher rates in 50-year-olds. And so these are younger people than were hospitalized before, and I think that's, again, a reflection of the fact of the most vaccinated population are older adults here in Georgia, and that we need to talk to our family and friends about the importance of vaccination. We have not continued to push to offer vaccines everywhere we can. I fully believe that it isn't going to a vaccination site that's going to motivate somebody, but having family, friends, your church members, having the opportunity to be vaccinated at the time you're doing other activities like grocery shopping or going to a farmer's market. Is when people will make that decision ultimately, and also engaging with primary care providers around the state, and we are working with them to ensure that they are able to offer vaccinations in their offices, and most importantly, counsel about the vaccine when their patients come in to talk to them and ask them questions. We actually had several events this weekend which were very, very productive. In DeKalb County, there were some incentive vaccinations there, along with sports stars, and over 1,100 vaccines were given out at that special event. In Savannah, there were special events around the farmers market and an arts festival, Say Yes to the Vaccine, which is a partnership that we're doing throughout the state with Home Depot. It was in Savannah this weekend, will be in Athens soon, and at the aquarium here in Atlanta. And people walked up, talked about the vaccine, walked away, walked back, and decided afterwards to get vaccinated. And they said it was easy, and that was one of the barriers that they had said was there before, that it wasn't easy. I didn't want to make an appointment. I didn't want to take time out of my day. I was there shopping anyway. And so you made it easy for me. I'm going to get vaccinated. And we're going to continue to do that throughout the state, even as we roll out increased testing. And the testing is a really important part of where we are now. As we're seeing increasing cases, we're also seeing an increasing proportion of percent positivity rates among the tests we're doing. It's almost 17%. So knowing that, we know we need to be doing more testing. We in public health are ramping up the testing associated with our health departments. We also are going to be offering to the hospitals to be co-located with them to offer testing as well, to ensure that they don't get overwhelmed with people coming in to be tested or with mild symptoms that would be better served just getting tested by public health. We want to do everything we can to keep people away from emergency rooms, that are overwhelmed right now, if they don't need to be at the emergency room, not only for treatment of COVID, but for many other things that happen every day in the emergency room, from heart attack, stroke, or trauma. So we're working with the hospitals and want to reassure everyone, because I know that some areas have not had easy access to testing. In the coming week, we are making that easier throughout the state. And I think that's all I have to say, other than that we will be offering the vaccine throughout the state, as will other providers, to those who are severely immunocompromised. That was the only expansion that the FDA, CDC, and their advisory group made that last weekend, actually. So ACIP said that it's just those who are severely immunocompromised, either because of medication, because of severe HIV disease, because of cancer treatment or organ transplant. But these are not booster doses. These are not doses to help others who may have chronic health conditions. This is a very limited expansion, an additional dose for those who may not be able to mount an immune response. We are anticipating that by the fall there will be more information about booster doses, and we'll keep you informed of that when that happens. So that's all I have for now. Thank you very much.
Governor, we're hearing from hospitals of shortages of thousands of nurses. What else are you looking into to address the shortage, because the number of new hospital staffers that you're funding won't fill that gap?
Well, listen, every hospital in the country, I would imagine, is looking for healthcare professionals. I know I read a report last week at some point where there was a shortage of 30 to 35% of the folks that are needed in these medical facilities. If you look at the heat map for the entire country, I mean, basically every state's dealing with the same issue, but it's not something that we haven't dealt with before. When I was on the Metro Hospital CEO call last week, at the end of the call, I asked them, the group collectively, I said, is there anything that we're not doing that you need us to be doing? And there was nothing that they said to me, because that's what they needed was staffing. I think the additional staffing that we talked about and announced today is just going to continue to help them with the surge that we're going through, and especially for our hospitals on the coast, South Georgia, and our more rural hospitals, even the central part of the state and other places. And just them having the certainty that we're going to continue the funding that we have and extend that into December, I think is going to give them a big boost, but also be able to keep the folks that they have and not be lured to go somewhere else and work.
Governor, you're giving state employees the day off, asking them to get vaccinated. Why not require it?
Well, look, I don't think vaccine mandates or mask mandates or mandates in general work. I think at this point, if anybody out there trusts the government, it's probably not many people. When you have the President of the United States that says, get vaccinated, take your mask off, then they reverse that policy. There's misinformation out there. And look, I get it. There's vaccine hesitancy in the South. I mean, if you look at the numbers in Georgia, and, you know, we're doing better than Alabama and Mississippi and Louisiana and several other states. I mean, there's real vaccine hesitancy. We've talked about that. Dr. Toomey talked about that with the Tuskegee experiment with African Americans. There's a lot of conservative, you know, white rural Republicans that have vaccine hesitancy. So that's why I have taken the take, instead of mandate, and I think that just pushes people into a corner. You see where mask mandates are causing fights at sporting events and on airplanes and other things. People know how to deal with the virus. My message to people is, look, talk to your doctor. Talk to your local pharmacist. Talk to whoever you trust that is involved in healthcare, or your faith leader about the vaccines. Learn more about them. Learn about the science, and then make a good decision for yourself. To me, that is the best way for us to handle this going forward. But, you know, I think giving our employees the opportunity to have a day off will get them thinking about that. Perhaps there's some out there that haven't gotten the vaccination yet, they'll take the time, either use that Friday to schedule their appointment. Perhaps it will encourage them to do it before that Friday so they can have a long weekend. And if they don't decide to do it, then they can come back to work. But I want them to think about doing it to protect themselves and their family and to help our folks in the hospitals out.
Governor, on the added staff for hospitals, will that be under the same existing contract that the state has been performing throughout the pandemic?
Yeah, well, we're going to
The
be
same
extending the
company?
contract. I mean, I can let Kaylee speak to that if you want to hear more details about that. You know, we are dealing with the market that's out there with other states, so we're addressing that issue as well. So I feel very confident, and she did as well. We actually just spoke about this right before we came out, that we're going to be able to be successful to start ramping up. It'll take us obviously a little while hiring that many people, but even a little relief in our hospitals right now is very helpful. Because you also got to realize there's a lot of healthcare professionals that have gotten COVID, or either they're not able to work because of exposures, which is hurting them as well. Not to mention the just normal volume. Before we went into this COVID surge that we're seeing, hospitals were extremely busy even before this started, basically back at full tilt because people had put off medical procedures that I'm sure you all will remember we warned against last year when things were shut down and people literally were scared to go to the hospital even when they needed urgent care.
Good afternoon, Governor.
Good afternoon.
As far as schools are concerned, we're seeing full grade levels shutting down, going back home. Some school systems started with thousands of cases to begin with. Are you reconsidering your guidance to schools or maybe toughening the restriction there? Can you speak on schools and COVID right now?
Well, what I'm doing with schools right now is supporting the superintendents and the principals and all the educators to make good decisions at the local level. This same thing in some regards happened last year. Students came back, teachers came back, some of them came back having COVID, not knowing it. A lot of schools had to deal with an initial surge and kind of fight through that, and every school's going to have to deal with that differently. I'm trusting them to do that. I don't think any more guidance or any restrictions. I actually think that would be counterproductive. I had a first grade teacher that told me this week on a visit to a school, please do not shut our schools back down. Kids that didn't go to pre-K last year, they are struggling in the first grade classroom because they're not used to being in that environment, and that is why we need to get our kids back. I visited 3 schools, including one this morning on the way in the last week or 10 days, one in Cherokee County, one in Wayne County, and then one in Oconee County on the way out of town this morning. And I'm very confident that they know how to deal with any issues. If they need to go virtual for a week or 2 weeks or delay as some systems are doing, I'm certainly supportive of that. But we also have systems that this is going to be their 3rd full week of instruction, and they're doing just fine, very few issues, and they're plowing ahead. And that is why I think the best approach is a local one. They did this all last year. Most systems got a full 180 days in, and like our daughter's school last year, I mean, they had times where they had to leave the 9th and the 11th grade at home and bring the 10th and 12th grade back for a week just to deal with the situation, but the next week they had everybody back in. And I think letting the schools deal with that individual situation that they have is better than a one-size-fits-all, overarching policy from the state or the federal government, I might add.